All right, it is 11:10, so we will go ahead and get started here. Our next session is What's Up with HIRTA. We'll go ahead and we have 4 members of the HIRTA team on here to kind of go over some of the things, different projects we have going on. First up is Julia. Julia's going to talk to you about the HIRTA Flex Connect program, so we will go ahead and turn it to her.
Hi, everyone. This is going to be one of our newest programs that will be starting in July. Mildred, can you advance the? It's a program that we're going to be starting in the city of Perry, and the CTAA, which was one of our speakers earlier today, was engaged by HIRTA to create a tool. And we did a needs and priorities assessment of the communities that we serve. And what we found was that the city of Perry has a large Latino population of 36% or 32%. I'm sorry, I don't remember exactly. And HIRTA was serving less than 1% of those. So it was identified as an area that we needed to make some improvements in. And so some funding became available through the Iowa DOT for special projects, and we applied for it and were awarded to do this Flex Connect programs. So we're going to pilot it, and it's going to be a checkpoint style transit. So instead of everybody going instead of our services all being door to door, we're going to have specific checkpoints what people can walk up to and get on, much like they do a fixed route service. But we will incorporate that also with people that we are picking up door to door. So we will have both of those services combined, and we're in the process of identifying where the pickup points are going to be right now. You can advance. So here's some things of why we found out that this project was needed. Is the majority of the Latino population either had no vehicle or they had one family vehicle, and the person that was going to work every day took that vehicle, which a lot of times left an older person and usually the mom of the family, and sometimes with children as well, to figure out how to do all the things that they needed to do during the day, whether that was getting to a medical appointment, getting the kids to school, doing grocery shopping. And as you can tell, like I talked about, the Latino population is 34.9%. We were serving less than 1%. 50% of the residents within the city of Perry have stated that transportation was needed to improve their health. Language and cultural differences, poverty, all of those had been identified as major barriers. And those who were undocumented, and even those who weren't, were often reluctant to use a government service, which many people see public transit as, especially one that requires personal information to schedule a trip. And so we knew we needed to do something different in order to meet the needs of that segment of the population. Next. So what we're going to be able to do is we're going to employ a bilingual transit coordinator who will be able to work with the families directly and understand the culture. They'll be able to, gain the trust of people and talk about HIRTA's services, and so that they can make them feel safe and comfortable and welcome. They'll be able to provide one-on-one travel training, small group travel training, or train the trainer travel training, which means that they could train others within the community, especially other agencies that serve different populations, on how to ride the bus, whether that's the door-to-door service or this new checkpoint service that we're going to be creating. We're going to be, or this position will be able to connect with the new Latino riders, and they'll be asked to complete a questionnaire about their current lifestyle activity, which will be tracked at 6 and 12 months. And that will also so that will allow us to collect ridership numbers, social determinants of health and quality of life data. In exchange for that, and this is not a requirement of them to use the service, but those who choose to participate in that and help us get this information will be able to ride the service free for a year. Next. They will also create an educational campaign using various media methods. And then we're going to be able to develop a comprehensive report on how to replicate the program. And we will also be creating marketing materials that will be both in English and Spanish, and be able to get that out. We don't know how we're going to do all of this yet, because we're in the process now of getting the job description finished up and doing the hiring process so that we're all ready to go on July 1st. Next. So this program is funded July 1st of 22 through June 30th of 24. So we have it for 2 years. The data, I should say, the data on determining social determinants of health will help change the narrative about transportation and provide useful data to enhance funding applications and opportunities. And one of the biggest parts of why we want to do this program is because when transportation is a barrier, our job is to step in and remove that barrier for the betterment of the entire community. And so we are going to focus this particular project in the city of Perry, but we are hoping to expand it to all of our communities, because we know that the city of Perry is not the only community in our service area that has a high number of Latinos. So we're really excited about it. We've been talking about doing something like this for a while now, and the funding came up and we were ready and we received it. So we're gonna move forward. And this is just our vision for that, we provide a service where all customers can have quick and easy options to pay fares, board buses, and arrive safely and comfortably at their destination. We strive for a future where transit agency borders and services blur, where interconnected transit options become apparent and easy for users, and where we operate with cultural competence. This is just one step in the right direction to make that happen. I think that's all I have to share. So quick and simple, but very exciting.
Hi, good morning. Next slide, Mildred, please. So HIRTA had submitted a proposal to the US DOT under the Joint Program Office, Intelligent Transit Systems for the US. It's a deployment program known as the Complete Trip. It's currently in a contract phase. As you can see on this slide, there are multiple phases to the project, and we have applied for the second phase, which will move into a grant in which we would start to test what we've developed so far. Next slide, Mildred. There were 5 sites awarded. They're shown here. Of course, HIRTA has a 7-county service area, which covers over 4,100 square miles of service. And we knew that there's too many healthcare systems within that vast area. So we picked Dallas County based on a few different factors: the proximity to the metro, the robust public health program, including they have some unique services with healthcare navigators on staff, and diversity that we don't see in all of our communities as well. Next slide. So overall, the project is really focused on how not just getting people from point A to point B, but how they actually manage things before their transportation starts, going out to get on the bus, their experience riding the vehicle, getting off the bus, getting into a building, and sometimes that also requires to maneuver within the building itself. So it's really everything, including the trip, not just the part where you're on a public transit vehicle. Next slide. One of the interesting things about this particular project is that all of them have to be replicable. So the goal, the overarching goal of this ITS for US program is to create and fund unique and innovative transportation solutions to make the United States have the best transportation in the world. Next slide. We did quite a few one-on-one meetings and reviews with stakeholders and even writers themselves, and we found kind of some high-level information. I think some of that we could have assumed, especially with talking to the healthcare partners, challenges in maneuvering through hospitals, how they find a cancer center, for example, within a hospital itself was challenging. A lot of different concerns about expanded hours, whether that be mobility on demand with same-day services or after hours. Next slide. And then that helped us identify 5 main or overarching goals for what solution we would develop. And we want to make sure that there's more spontaneity. We want to help focus on underserved populations, and we also want to make sure that everything is safe, that the services that we develop are sustainable. Next slide. And if you look at these 2 images, the image on the left really shows the way that transportation services are today. You have a person who needs services and they're reaching out to their healthcare provider. They're reaching out to transportation. Within Dallas County, they'll be reaching out to healthcare navigators when they don't know what to do or they don't know what resources might be available. And then in some cases, they're working with private funders. That might be Medicaid, that might be a county-funded mental health program. They may be looking to Aging Resources of Central Iowa as an example. But they're taking all of these things and they're reaching out and trying to find assistance. So we want to move over into something more like the image on the right, where we're placing the writer as the person-centric, person-first model of service. So really this health connector solution that we're developing will kind of sit there and do a lot of the communicating for the person, making it easier and streamlining the process for everyone. Next slide. What we've decided to do, because part of this program, again, it has to be replicable. So we want to make sure that the solution is something that has openware, whether that's an API or just open source development. We determined that having a middleware made sense. So this way, there's something that sits in the middle between what HIRTA uses for scheduling and what the healthcare systems are using for scheduling. And it kind of controls that traffic, and it's more easily integrated by other systems that are interested in the future. Next slide. Again, there's multiple phases to this particular project. We're waiting to find out, we should know by the end of May whether we're awarded phase 2, in which we would really start to deploy the solution and integrate it into our services, test it out. And like Julia mentioned with other projects, our goal is to use this pilot area to kind of develop it and get things working well, and then to integrate it across the rest of the HIRTA region. Next slide. We have a brief video. It's a little over a minute and a half that kind of better explains the project. So we're going to go ahead and play that now.
Coordinating transportation to your health appointments can be a challenge. Missed medical appointments cost the healthcare system over $150 billion annually nationwide. Imagine the possibilities. What if you could schedule both a medical appointment and transportation at the same time? What if language and limited mobility did not present a challenge? What if technology helped you find your way around a medical facility? HIRTA was one of 5 sites selected by the U.S. Department of Transportation to create an innovative solution which can be replicated across the country. Transportation and healthcare organizations will partner to streamline the appointment scheduling process. Here's how the process works. When it's time for your appointment, your scheduled transportation partner will pick you up and take you there. Upon arrival, follow navigation with turn-by-turn directions from the time you leave the vehicle until the time you arrive at the doctor's door. Upon completion of your appointment, the return trip is initiated, and navigation directs you to the transportation vehicle to complete the trip. To make this possible, we have partnered with IBI Group, Route Match by Uber, Community Transportation Association of America, and Dallas County Public Health to develop the Health Connector concept. Project results will address mobility solutions in Dallas County and increase healthcare access and outcomes. We need your input. To learn more, reach out to HIRTA by emailing healthconnector@ridehirta.com or call 1-877-686-0029 for more information.
Thanks, Mildred. You can go to the next slide. So again, we're not at the point where we're implementing this today, but we're getting close to doing that. We're really excited about it. I would say if there's folks from other transit systems on today and they're interested in doing something similar, we have struggled with getting participation from some of the actual health providers. The folks who are on the floor at the ground doing the work, you know, they definitely understand the importance. They've fully support and share the need of this. But where we've struggled is with the admin side of things and the leadership and their participation. And we're hopeful that as we move into the second phase and it's a little less of the research, that they'll start to be a little more excited about what we have going on. And I think it's just hard when it's research and you're just asking them a bunch of questions. And as usual, everyone wants to see the solution, not all the work that goes in behind the scenes. So exciting things. Danny, you're up next.
All right. I'm going to talk a little bit about HIRTA's Do You Have Transportation program that we've been working on. Go ahead and go to the next slide. So do you have transportation? Basically, the overall goal is to, get people to think, do I have transportation? To do this, we're, connecting with local facilities, chiropractors, dentist office, family medicine, pretty much any facility you need transportation to get to, like a medical appointment. That's what we want to work with. So basically, the project includes connecting people to HIRTA, if they don't have transportation. Next slide, please. So the average no-show rate for the United States healthcare industry is 18.8%. Obviously, that's a little different for Iowa and smaller towns. But you had heard Scott talk about no-shows earlier in the Beyond the Bus, where it's just a big problem. So of that 18.8%, missed appointments cost $150 billion per year. And on average, it takes 8.1 minutes to schedule an appointment, but it takes 2 seconds to ask, do you have transportation? So basically what we want to do is we want to incorporate this program into a facility. So for example, we would provide them with all the materials, notepads, magnets, pens, whatever they want. And, when they're scheduling the appointment, the last thing that they do you have transportation to get there? We are thinking that is going to help them kind of get that no-show rate down. And it also helps provide riders to HIRTA as well. Next slide, please. So high cancellation fees equals scared and unhappy patients. Scared and unhappy patients can lead to not scheduling appointments, which we definitely don't want because we want to make sure everybody gets the access that they need. So in order to do this, we've come up with a very intricate and helpful formula, which, go ahead, Mildred. So sad people plus HIRTA equals happy people. Basically, we want to provide that service. We want to make sure, the sad person, the sad patient who doesn't have transportation has transportation. We want to make the sad clinic, incorporate HIRTA's do you have transportation, and now all of a sudden they're happy clinic. So we just need to bridge that gap between HIRTA and the facilities, which we're hoping to do. And we have a few clinics that are participating and are having success, and they like it. It's very simple. Like I said, it's as simple as, do you have transportation? If they say yes, great. If they say no, then that you hand them a HIRTA brochure, you hand them a notepad with HIRTA's do you have transportation logo and information, and then we'll take it from there. Go ahead, next slide, please. So as I said, the facilities, ask, do you have transportation? And they hand out the materials. What each facility does is up to that facility. If you want to be super hands-on, then, great, we'll work with that. If you want to simply leave it as, putting HIRTA brochures and the materials that I had mentioned, if you want to just put that up and that's where you want to end it, and that's fine as well. It's up to each facility how much they want to be involved in this. Next slide. So what we do is we provide the materials and restock when necessary. We'll start you off with a bunch of magnets, notepads, and then we help implement the program. I'll go and have a chat with whoever's in charge, and whoever's, in charge of scheduling, we'll help implement the program. Here's what you need to do. Here's what you need to say, like hand out. Here's some basic questions you can answer, when folks try to schedule an appointment. And then just try to track results from the program. Part of our onboarding process is to ask, how do you hear about HIRTA? So we're hoping to see, we heard through, a brochure from this medical facility. And then from there, we do the rest of the work. We get the people, on to their appointment on time. So we handle all that as well. Next slide. So here are some of the materials that I mentioned. The bottom right's a magnet. The top right one is a notepad with that logo. And the first check mark, do you have transportation? So that's the first thing you need to be thinking about. The thing on the left is an infographic that we had created that has all of the necessary information. The 8.1 minutes, takes 2 seconds to ask, do you have transportation? Has our email, our website, and then of course, the purpose of this program. So it's a really great program. We're hoping to, really get this off the ground. We'd run into some issues with COVID, and, definitely not a great time to get a facility to start, a new program at their facility. So now that, COVID's kind of slowing down and, we're getting to a new normal, I guess, we're having some more interest in it. So hoping to get some facilities, and we'll take it from there. Mildred? And then there's my email if any questions. Otherwise, Mildred will be talking about the volunteer program.
All right. So I'm Mildred, the volunteer coordinator, and I'm here to talk about RSVP and our other volunteer program. RSVP is the Retired and Senior Volunteer Program. It is a national program through AmeriCorps Seniors. As you can see on this map, there are a lot of counties in Iowa that have an RSVP. Each RSVP is slightly different in what their focus area is. Our focus area is healthy futures. So we are focused on getting nutrition, transportation, and our Friendly Neighbor program to the community members. With nutrition, we are looking for volunteers to provide transportation to the grocery store, to food pantries, as well as cooking meals for community members in their homes. With the transportation, this is medical transportation, so going to the doctor's office, support groups, or the pharmacy. And then our Friendly Neighbor program is to provide companionship to community members by providing social visits or maybe even providing transportation to local events to get them engaged in the community. With our other counties that we have, so this is for Madison and Marion County, and then we also have transportation, medical transportation in Dallas, Boone, and Warren County. And this is a quote: no act of kindness, no matter how small, is ever wasted. With our Rsvp, we can partner with local nonprofits and public agencies to provide them with volunteers. So we are currently partnered with Aging Resources, the Alzheimer's Association, Bricker Price Block, Madison County Emergency Management, Iowa Fraud Fighters, and Pella Public Library. And we're looking for more nonprofits to partner with as well. So if you're in Madison or Marion County and you would like to partner with us, reach out to me. And then the benefits of volunteering with Rsvp. AmeriCorps Seniors does a lot of research into the benefits. So one of their points is that 84% of AmeriCorps Seniors volunteers have reported stable or improving health after 1 year of service. Volunteers also have reported decreased anxiety, depression, and loneliness. And then with our program, we're looking to connect older adults within the community. So 88% of volunteers have reported if they felt a lack of companionship, they now have fewer feelings of isolation after becoming a volunteer. And with Rsvp, we look to decrease barriers to volunteering. So we provide mileage reimbursement as well as supplemental and liability insurance to our volunteers. Thank you.
Then Mildred, did you want to share your RSVP video?
Sure, but I don't have it pulled up.
Danny, you want to go through some of the questions while she's doing that?
Sure. Let's see here. Moises says, is there a Spanish version of this explainer video? I know some nonprofits that specialized in the Latinx community and would love to share and know more about the program.
So that reminds me, I forgot to mention earlier that part of our goal and what we want to create with this Health Connector is to have a way where people can schedule their healthcare and their transportation at the same time. That will include translation services in like 30 different languages, and to have the wayfinding where it helps them maneuver within buildings to get to their doctor's appointment. We have not developed a Spanish version of the video, but if we do move into phase 2, which we think we will, then there will be 2 additional videos created and a whole marketing plan to roll things out that involves a lot of community engagement and integrates with focuses on different social media channels, and even includes WhatsApp, because we're aware that WhatsApp is used by a lot of folks who have limited English proficiency or speak English as a second language. So we definitely have that on the radar, and it's something we will be working on more as we move forward.
Next here, Cherie says, what facilities are you proposing this idea and giving notepads to for reference for the client? Pretty much anything that has appointments. A dentist office, a chiropractor, mental health, pretty much anywhere where they're scheduling appointments where riders will need to get rides to. So it started as, just certain, in my mind, when I first started this, it was just, okay, doctor's office. And then somebody said, oh, well, what about mental health visits? Like, well, that's a great idea. So we started doing that. So basically anything that needs appointments, that's what we're hoping to give people rides to. Then Mildred will share this video real quick and we will continue with the questions.
Are you 55 or older? Do you want to serve your community and make a difference? HIRTA is recruiting volunteers. Here are some ways to help your neighbors. Drive someone to their medical appointments or the pharmacy. Help prepare a meal or go grocery shopping. Visit or read with someone. Write notes to isolated neighbors. Attend local events. Volunteering with HIRTA has great benefits. You are matched with opportunities which fit your commitment and interest. Volunteering positively impacts you and your community. It improves physical and mental health and decreases the risk of isolation. Be involved in your community. No experience is necessary to volunteer. Volunteers are provided program orientation, training, and support. For more information, to complete a volunteer application, or to apply for assistance, call 1-877-686-0029 or visit our website, ridehirta.com/volunteer, or email volunteer@ridehirta.com.
That was the RSVP video that's available on our website, our YouTube, and then if anybody has any questions, then we typically send that out to, hopefully answer their questions. Chris Mondak here in this chat says, Danny and Brooke, in your efforts to work with healthcare facilities to increase access to transportation and reduce no-shows, have you encountered any healthcare facilities that would be open to scheduling appointments for the older population at times that HIRTA is most available to serve the needs?
I can kind of start with that and say, Chris, we have experienced, not just recently, but over time, that a lot of doctors' offices and facilities, healthcare facilities, are trying to be flexible with people if they're made aware that transportation is a challenge. And that could be anything from needing specialty care in the Des Moines Metro, for people who are commuting from our service area. But that could be even with just the local doctor's office. However, we've found, especially with older adults, that people don't want to question the doctor. So as an example, my grandma, she would never ask the doctor to adjust a time of an appointment. If they say tomorrow at 2, that's when she's going, because she doesn't feel that that's a question that she can ask them. I know that's just my personal experience and what I've kind of seen and tend to see with some of our ridership. But Danny, when you've been talking to the facilities, do you have any feedback?
No, I haven't encountered any of that, but it's a good idea, especially to keep in mind when I'm talking to these facilities of, hey, HIRTA serves this county from 7 to 4 Monday through Friday. So if they don't have transportation, maybe we can try to fit that in that time frame. So it's definitely something I will keep in mind for the future. So thank you, Chris, for that tip. Any more questions here in the chat? Anything about any of the 4 programs or anything HIRTA has going on?
We can throw some links in the chat as well. Like Danny said, he'll send those out, but we can send some links over to the different videos that we've shared and some information on our website as well. Again, that can be included in the chat today, but it'll go out after the day is over as well.
And one of the things I wanted to say about the do you have transportation is, in talking with some people, we learned that if they decided that they did not want to go to the doctor for whatever reason, whether that was fear or they just didn't feel like going that day, they would just tell them, I don't have a way to get there. That's how they would cancel their appointment. So we wanted to try to make that on the front end, that we're asking if they have transportation, so that that isn't necessarily the excuse that is easy for people to just throw out there, is that they don't have a way to get there, so that we could really have a better focus on those people that really do have a struggle to, that where transportation's a barrier. So that's part of why we're trying to do the, do you have transportation, is a better way to serve people.